Hey, Bethany.
Hi, Jen. How are you today?
Good.
Normally I say you ask me how I'm doing.
How are you?
I'm kind of, I'm usually feeling very good. Today I'm feeling a little anxious. And I
Mm-hmm.
think because today is a very big day, it is election day.
Yes.
And so I am proudly wearing my
I
sticker.
love it so much.
And I was thinking how it relates to our topic today about what it felt like to be a high risk patient,
Yes.
expectant mother, and how sometimes I wish I had a sticker that said, I'm a high risk.
Treat with care.
You treat with care, be kind. Maybe don't ask me some stupid questions because I think it's very common that, like, when somebody sees somebody who's expecting, they'll say things like, oh my God, are you so excited? And I was thinking on my way here, I'm like, I don't know if I ever felt really excited about any of my pregnancies because
Mhm.
I was so nervous. And
Yeah.
so I never knew how to answer that question. And if it was somebody I felt safe with, I would be honest. But most of the time, I didn't want to get into a whole conversation or say, yeah, I'm so excited and just put that fake face on. For every single one of my pregnancies, I almost had to coach myself like, before I'd go, like, out into the world, at the grocery store, at whatever, to be
Yeah.
like, "How would I respond to this question today?" Because every day, too, was a little bit different on how I was feeling,
Yeah.
and
But your background, you know, you had something traumatic happen to you
yeah.
with the loss of Campbell prior to all three of your pregnancies. So, of course, and there's so many reasons that people might feel anxious
Yeah,
or not terribly excited. Even if they're obviously happy or
yeah,
not even obviously, but if they're happy and ready to have this baby,
yeah,
there's so much that people have to worry about.
totally, and even if you didn't have a history of trauma, I still think any patient who is considered high risk
Yeah.
goes into their pregnancy, you now have a label on you.
Mhm.
And you now just feel like everything is about getting to the end, getting to meet that baby. I couldn't see the end goal until it was there. I couldn't prep for it. I just had to go day by day.
And just kind of like get through it.
Just get through it.
Was there anything that you did enjoy about pregnancy?
I enjoyed being home in bed because then I knew nobody was going to ask me any
Oh my
questions. And
I
then that's when I would feel the baby and connect with the baby, but I didn't find myself connecting outside my home as much because it was just like I was just in go
you
mode.
you kind of associated it with the questions or
Yes.
people being intrusive
Mhm.
and maybe taking you to a place that you don't want to go,
Right.
which is totally unfair.
But home and my
Home in your
bed
bed.
was my favorite place to connect with the baby.
Yeah.
And I was one that I did have a Doppler, so I listened to the baby's heartbeat very often.
Yeah.
That gave me comfort.
Do you think that gave you any more anxiety?
Well, because I knew where to place it,
Yeah.
I think that I I felt in control,
Mhm.
but I do think that a Doppler can be nerve-wracking.
Right.
So a Doppler is a device that allows you to hear the baby's heartbeat. And I'm not going to lie. I mean, the second I would put it on, if I didn't hear it immediately, I would like hold my breath for a second,
Yeah.
but then I would move it just slightly. And by
You
the
would find it.
I would
Yeah.
find it. That's what gave me peace at the end of the day to go to sleep. I
Yeah.
was like, okay.
So I agree. I had one too.
I don't doubt that.
Obviously.
Yes.
And some, I think, will say that they don't recommend it because
Right.
they think that, obviously, if you're just not doing it right, and so then
Mhm.
you can't find the heartbeat and really it's there, then it causes unnecessary anxiety.
Mhm.
Right. I agree. You're right. I could figure it out
Right.
and I would find it.
Right.
And it definitely made me feel better. I mean, I think I was a little like addicted to it,
Me too.
which is
Well,
probably not great.
right. That might be the negative of it is it became my nightly routine, sometimes like
Yes.
5 times a day routine.
Yes. Yeah. Yeah.
But but
But we that anxiety is there. I think,
right.
I'm naturally anxious for sometimes
Mhm.
for reasons, sometimes for not reasons, just because
Yeah.
that's who I am.
Yeah.
And also, even though I didn't, prior to my first pregnancy, hadn't experienced anything
Yeah.
super traumatic myself,
Right.
seeing trauma in other people all the time,
Yeah.
it makes me at the ready for
Of
something bad
course.
to go wrong,
Of course.
maybe more so than other people. And it's so funny, some people go through pregnancy and they like maybe get one ultrasound or no
Yeah.
ultrasounds and they don't want them. And I'm a little envious of
Yeah.
the ability to be so chill,
So true. I agree with that.
you know?
I think that is amazing that they're trusting and they know and they're positive and but that's where you have to find that like perfect balance of what do you need, you
Yes.
know?
If this is something that's going to make you feel better and help you sleep at night,
Do
I
it.
mean, yeah,
Do it.
yeah.
Oh, that's my
Can we talk about what exactly defined you as high risk? And is it something you always knew from the second you got pregnant because of everything that happened with Campbell? Or was there anything additional that happened after you got
that I'm a
pregnant?
yes. So obviously because I had a stillbirth, I was always going to be considered a high risk, especially because there was no workup that was able to be done to determine what caused the stillbirth.
Right. And the high risk really meaning the pregnancy itself was high risk, not you
Right, as a
as
patient.
the mother.
I
Yeah.
didn't have any medical conditions that I was aware of that
Mhm.
would have contributed to the
Just
stillbirth.
because you have this history, you needed to be followed closer. The baby needed to be
Right,
followed
right.
closer than maybe if you didn't have that history.
But before I got pregnant with Souther, so after the stillbirth, I had to see a lot of different hematologists and trying to find out the cause for it because I obviously wanted to get pregnant again, but I didn't feel comfortable getting pregnant again until I had some more answers.
Yeah.
It will always be something that I hope one day I know an answer to. I have digested that I may not, and I guess that
But you did
is
get
okay. But
somewhat of an
I did
answer.
get somewhat of an answer. The hematologist determined I have a protein C deficiency, which makes me a higher risk for blood clots. So essentially, we can say the hypothesis of what caused the demise was that there was a blood clot that occurred. Probably the umbilical cord is a discussion that was out there,
Yeah.
and that her demise saved my life. So that's something that I had to process,
Yeah.
and I'm grateful to be here and to have my 3 live children. So, once I got that, diagnosis, then it was like, "Okay, so now what am I gonna do when I get pregnant so that this doesn't occur again?"
You weren't getting IVF treatments, right?
Yeah, yeah,
I did not know that.
yeah. I had basically medicine that helped me get pregnant
Okay.
versus having a transfer.
Okay. So you
Okay,
had
I
kind of
didn't
all the workup through the fertility specialist, and then
correct.
they gave you something extra,
Yes.
not IUI
No,
or
I did Clomid
IVF.
and
Okay.
Avidro.
Okay.
And they're basically boosters,
Yeah.
to help. And that was like a 6-month journey.
And so they found out that you had the protein C deficiency, and so your blood is more likely to clot. Is this something that you need to worry about getting a blood clot outside of pregnancy, or it's
Um,
just once you're pregnant, that's kind of the second
correct.
factor? So anything with the fertility treatments, did you have to be treated for on any
No,
blood
well,
thinners
so
or
I
anything?
started on baby aspirin
Okay.
while I was doing fertility so that we were just like on top of it. And that's why I loved my fertility doctor because she worked closely with my hematologist. They created a plan based on my particular needs.
Yeah.
And so then once I got pregnant, that's when my anxiety really started picking up. I was so grateful to be pregnant. However, I was like, okay, so what are we doing besides a baby aspirin? I mean, that
Yeah.
didn't seem like enough for me. And in those early weeks, they didn't want to start me on injectable blood thinners until I was far enough into my pregnancy.
Okay.
So at probably about, I think it was between 12 and 13 weeks, somewhere in that time frame is when I started taking Lovenox.
So were you worried? Obviously, you're worried about the baby not going through what you went through before and
Hmm.
the baby making it to term and everything else.
Yeah,
But were you also worried about your own health as far as getting a blood clot
for
if you were
sure.
pregnant?
For sure. Yeah. And so I have to say, even though it's not like I don't think it's that painful to there were certain areas of my abdomen that I would stay away from that I'd like go to give myself an injection. I'm like, oh, that really hurts right there. So I'd stay away from that spot. So I would like
Yeah.
make little X's on my
Those are the
belly
good spots.
on the good spots. And actually, I do recommend that because it took me a little bit of time to figure that out. And it was this like therapeutic thing when I would be injecting myself in the morning to be like, okay, I'm going to get through another day because I know that this medicine is ensuring that I'm not going to develop a blood
And sort
clot.
of you're doing something proactive
Yes.
for your health and the health of your baby.
Yeah.
And so that kind of felt good
Oh, it
to
felt so,
you.
and it was my routine in the morning. I woke up, I brushed my teeth, I gave myself my injection.
Yeah.
And then it was like I could process the rest of the day.
And did you have any trouble with the injections? I know obviously you're being a nurse. I have not had to do that. I
Okay.
don't think it would bother me, but I know,
Oh,
pretty much all of my friends who have to inject themselves, it's a
yeah,
very
nerve-wracking.
nerve-wracking process. They don't,
Yes.
you're not used to even assuming you have to drop medication.
Yeah.
Yeah.
Yes. Yeah. I mean, even though I knew how to do it, I would still be like, "Oh my gosh, is there an air bubble? Like, let me make
Yeah.
sure that I'm, and I like do that a little bit. I'm like, okay, I see the liquid coming out. All right, I'm good to go. So yeah, for sure. Even with my knowledge base, I was still nervous, and that's why I think identifying areas on my abdomen that I knew was a good spot to inject in took that kind of concern out of it, and injecting it slowly versus like a stab. But to me, it was like I had to do it all very calmly. It's also how I would do it for patients. I just kind of followed what made me feel calm as a nurse. I really tried to put on myself as well to be like, stay calm. You know the spot.
Yeah.
Inject it slowly.
Yeah.
You're good. You
Yeah.
know, use alcohol first.
Okay. Yeah. Not to drink, just
Right.
to
No. Yeah. However, though,
Yeah, yeah.
maybe that would have helped decrease my anxiety a little bit. But then essentially, yes, because I was on blood thinners, and of course I was considered a high risk patient now
Okay.
for two reasons.
Okay.
Because of my previous stillbirth and because I was on blood thinners,
Okay.
which
And so you're on blood thinners because you're at risk for a blood clot.
correct.
So this should be kind of counteracting that risk. But so what do you mean by the being on the blood thinners making you high risk?
Well, it was more so I guess it would have been it's for the delivery,
Right.
right?
Do you remember what type of blood thinner you were on?
I was on Lovenox.
Okay.
And then transitioned to heparin before the delivery. So that's why I had a planned C-section
Okay.
because there was a time frame in which I had to transition off the Lovenox and start the heparin.
Okay. And other than the being on the blood thinner,
Yeah.
was there other reasons you had the C-section? Or they kind of told you because you're on Lovenox, you have to have a C-section?
Yes. Yeah. And also I knew you were gonna shake your head on that. I think also too because it was a third trimester loss, my MFM was kind of like normally I'd want to deliver pretty close to that date.
Okay. So
However,
need for earlier delivery,
yes, but
potentially.
at a
So that does happen with patients who've had late losses
yes.
where a there's a reason, I don't know how to say this. It's not indication is not the word.
Mhm.
So even though there's no quote unquote medical indication, but let's say if you had a loss at 38 weeks and they
Right.
deliver you at 37
Right.
after, discussing with the patient, did they deliver you early at all?
Yeah.
Just
I got delivered at like 36 and
36
4 days
and
for
4.
my first. And then my other two are like 37 in 1 day. So
Yeah.
that's when I think that shift was like, let's get to 37 weeks
Yeah.
before delivery.
Did they have that discussion with you about the
Well,
risks and benefits of early delivery?
yes. Yeah. And to me, a big part of it too was how I was then coping in the pregnancy. Because
Yeah.
once I reached
Which is so
28
yeah.
weeks, then I started my NSTs, my non-stress tests, and that was every single week. And even in those, like, of course, that was once a week. I was still checking my Doppler every day,
Yeah.
but that kind of monitoring constantly, weekly, allowed me to get to the 37 weeks, so the 36 weeks and
Right.
4 days, because mentally I started not coping, and with
Of
my
course.
first, it was easier because I didn't have other children at home. With my other two, like one time I went in for a non-stress test and I had Souther with me, and Souther and Sawyer are 21 months apart. So maybe he was, I don't know, 18, 19 months. And I had moved to Connecticut at the time. I didn't really know anybody here. I had like a couple friends, but I went in and they were like, "You are having contractions," and I was like, had Southern in a stroller. I'm on this table, and I'm like,
Okay.
okay.
Yeah, what is
And
are
they're
you
like, "Are you
worried or
feeling
not?
them?"
Yeah.
And I'm like, "No, I'm not feeling any of them." And then they would come and they're like, "You didn't just feel that?" And I was like, "No, I did
No,
not
and
just feel
that's a
that."
very important distinction if you're feeling them or not, whether or not you see
Exactly.
them on the monitor.
And so they're like, "Well, we're going to have to keep you here. So who's coming to get your son?" And at the time, my husband was in the city. I called my sister and I was like, "You got to get on a train because they're telling me they're going to keep me here and he cannot stay."
Like,
And
overnight?
they
Or
just
just for a few
for a few
hours?
hours, but
And, like, we can't babysit your son
exactly.
for
And I was like, "No, he's a really good little boy. He has his toys, you know." But that,
There really should be a better system for that because there's so many times that that can come up, if you
yeah.
don't have childcare and you need to go.
And when you're going weekly, for
Right.
me, I was going weekly. So it was, should I have gotten a babysitter? Maybe so, of course. But like,
Not everybody has that option, though.
exactly. Sometimes it didn't come together. So going back to, sorry, I feel like I kind of went all over the place there. So being monitored with my first was a different anxiety level than being monitored when I had other children at home because I kept feeling like I have to get back
You
to
had somewhere
them.
else to be.
Yeah.
Yeah.
So I can't, I will always, I felt very good coming in for the test, but it also caused anxiety of be like, will I get to go home? Like,
Yeah.
will you want to deliver me right away?
So with Souther, who you had at 36 weeks, was there ever anything wrong with the NSTs or the monitoring, or that was how did they make that decision for the 36 weeks?
So you know what? My MFM just made the decision and I just trusted it.
Yeah.
I mean, I think back on all of that, like, I wish I would have asked so many more questions, but I don't think I was in the mental space to be able to ask questions. I was just like, whatever you're going to tell me
Yeah.
that you think is a safe thing to do, I'm going to trust, and that's what I'm going to do.
Okay. So they probably felt that you were based on, I guess, probably the clotting disorder
Yeah.
and the 28-week loss
Yeah.
at risk for losing another baby, enough so that they wanted to deliver you nearly a month early
Yeah.
to be sure the baby comes out safely. And
Not a month early. He was 36.
that's a
Well, okay.
month,
Yeah, I
4
guess.
weeks,
Okay.
3.5 weeks.
Okay.
It's not, it's,
It's not, I guess I never thought about it like a full month, but I guess I guess you're saying it out loud. I was just
yeah,
like, it's just a couple weeks early. Well,
it's
see,
not, it's, 'cause
that's
it's not really bad. I
but
mean,
that's what I
it's
told
not most
myself.
36, I think I've said before, did he get steroids? You remember?
No,
Hmm.
no, I
Maybe
know.
it was very close to 37.
No, it was 36 and 4 days.
Okay. Well, it's not 37.
Okay. We're gonna go back and forth on numbers today, Jen, aren't we?
Well, the guidelines are there.
I know.
Oh, I
I
love
think
my
that's.
guidelines.
I know.
But he was fine. He didn't need
He
to go
didn't
to
have
the
to go to the
NICU or
NICU,
anything. Yeah, so 37 weeks is basically
right?
cooked,
Right.
for the most part.
Yeah.
And then, yeah, so if you're so close to that. So, I mean, I guess I'm trying to get into the mind of your doctors, which of course I can't.
Yeah.
So you had this history.
Hmm.
You're extremely anxious. You want this baby to come out
Yes. I also think
safely.
too, maybe one of the things that I'm actually now thinking back on. So at 28 weeks, they did basically a detailed anatomy scan in the office.
Yeah.
And I had to stop it because I couldn't look at a 28
Oh,
week
geez.
baby. And I remember it was like that appointment was supposed to be whatever, however long. And I was like, talk about like deep breathing exercises. I couldn't control myself. I couldn't calm myself. I couldn't look at the monitor. I couldn't look at the screen. I was
Yeah.
just like, I can't cope with this right now. And
It's
so
bringing everything back
I
for you.
do wonder if my doctor put that a part of why
Right.
his
Even if you didn't
rationale.
verbalize it,
Right. I didn't have to.
right, you did. Yeah.
I
The
wailed.
signs were there.
The wailing,
Yes.
even like he came and he was like, how, like, He's like,
Yeah.
"You're like, you really need to calm yourself down. I know this is upsetting, but it was just
Oh my
and
gosh,
so
that's so
I
sweet.
didn't even like sometimes it's like again these things it's like I block out until we start talking about it and I'm
Yeah.
like, "Oh yeah, that did happen."
Right.
That experience did happen and so I think that I'm sure was a part of his case for why he wanted to deliver the baby as soon as it felt
Yeah.
safe and stable.
So now because you're earlier,
Mhm.
if they were going to, let's say, induce you at which they could schedule an induction
Yeah.
as much as they could schedule a C-section, but, it's a little bit more challenging to do an induction when you're
Yeah.
not as far along in
Right.
pregnancy sometimes,
Right.
especially it would have been your first delivery.
Right.
And so I understand. And I feel like he knew. It sounds like he knew you and knew that you were okay with the plan, so it didn't
Yeah.
have to be too much of a discussion.
And actually, I mean, it's like I hate that I'm even gonna say this, but like I don't even think I wanted a vaginal birth for
Yeah,
my
say it,
first
girl, say it.
because I don't like
It's
I don't think I
okay.
trusted my I you know what it really comes down to is I didn't trust my body enough
Yeah,
because my body had already failed me and I didn't want to have to and how many times I'd spoken to him about, "You've got this, your
right.
body, connect with your body." I'm
Yeah,
like and then here I am totally
but
disconnecting with my body, not trusting my body, like, could not
yeah,
be the more opposite of what I was teaching, but then it goes back to, like, how our experiences change us that,
exactly.
like, I don't
It's
think
okay.
yeah,
I just
okay,
wanna
thank
tell
you.
you, it is okay.
Thank you.
It
Yeah,
you that's what I was kind of trying. I mean, we haven't actually had this
I
conversation
know.
before,
Yeah,
and I never wanted to ask you,
yeah,
you know, directly.
yeah,
It was sort of just, well, I had to,
yeah.
and, there's a lot of
So ask me
things.
with a microphone and our headphones on, Jay.
You chose this topic.
I know.
But I think it's okay
Yeah,
to say that, with a C-section, it's a pretty there are problems, okay, it goes both sides, right? Where we see some increased risks from C-section,
yeah,
but you're also eliminating some people feel when they're extremely, extremely anxious, as someone would be who has lost a third trimester baby with their previous pregnancy, it's the first time C-section,
yeah,
right? For you. So the surgery should be
yeah.
straightforward and uncomplicated.
Mhm,
And not that we don't ever see problems with deliveries during C-sections, that can absolutely happen.
mhm.
But if you weren't at risk for any of those things, it should be pretty easy for the baby to come out
Right,
quickly,
right,
basically.
right,
And
right,
once the baby's out, it's done, right? The
right.
delivery process, any stress of the delivery process
Mhm,
that could occur to the baby is gone, right?
mhm.
The baby is here, the baby is safe.
Yeah,
And so I just want to validate
yeah,
that feeling. No one should ever have that feeling pushed upon them,
yeah,
like someone who doesn't want a C-section. I think sometimes that's used for people who don't want C-section to say, well, it's just safer. Let's like just get the baby out.
right,
But it's also makes sense
yeah,
that part of you would not be able to go through potentially a long labor.
mhm.
I mean, the reality, if your baby's on the monitor
I was gonna say, if that baby
and
had shown me any
baby
signs
starts
of
having D
distress,
cells
please,
and
no.
it's just a normal, just something that can happen. A lot of people go through when they're in labor, we'll see something on the
Yeah,
monitor and everything ends up being totally fine.
yeah,
And that would be very, very difficult
yeah.
for you.
Yes, yeah.
Very
I
difficult.
think it would have just triggered too that feeling of being back on L&D as a patient. It's always easier to teach others and to calm others, but it's very hard when you're trying to do that for yourself.
Yeah.
And I also think there was a big component to like, I didn't even want to be in one of those rooms because my
Yeah.
last
And that's
memory
fair.
of being in those rooms. So
Of course.
I think there's probably for for my case, I think that there was almost a 50-50 medically, it seemed like the safest, but emotionally for me, it was the safest choice.
For sure.
And I remember when the nurse who I told you, she, like, told me that it was gonna feel like kitty cats running up my
Yeah,
legs when the
the spinal.
anesthesia okay. And I remember when she said, "Are you ready to meet your baby?" And I said to her, "Only if it's alive." And I felt like they had already obviously read my chart and they knew, but, like, that was the like,
That was your
that
mindset.
was my mindset.
Yeah.
Only if this baby is alive. And if
Yeah.
it's not, like,
Yeah, you
let's not even go
cannot
there, you know? And
go
so
through that again. Yeah.
so that's where I was to get and that's why,
It's
that's why I think planned C-sections, like, we know that they sometimes get this negativity wrapped around them, and I think that that is an unfair way to describe a planned C-section because you don't know all the
you don't know.
layers.
And your story, there are people who have stories similar to yours, but nobody has your exact
Right.
story, your exact experience. The fact that you were in what room you were in or where you were when this happened to you before, and the clotting disorder diagnosis after, like the layer upon layer,
Mhm.
nobody experienced that, exactly the way you did.
Yeah.
And I can tell you many people have similar but different reasons for coming in and having the planned C-section. I think I maybe mentioned this before, but I always try to advocate against, I guess, OBs forcing a C-section on anyone.
Right.
So I always look at whenever I'm going to go see a patient who is coming in for a planned C-section,
Mhm.
and I look at their chart and I can't tell exactly, it's not placenta previa
Right.
or breech or having their fourth C-section,
Right.
and I'm unclear. I'm reading through the chart and why is
Yeah.
this patient having a C-section? And it might say somewhere about the baby is a little big, but then I look and the baby's bigger, but the baby is
Right.
not meeting those criteria for being, over 11 pounds or something like that.
Right.
And they're kind of saying it's because the baby's big. I'm like, well, that doesn't make sense. Why would
Yeah.
you say that? So then I go see the patient, and there's almost always something missing
Yeah.
from that chart. Yes, the baby being a little big is maybe part of it, a piece
Mhm.
of it, but it
Mhm.
was like 5 different things
Right.
that they, is part of their history. Like when I was thinking about this topic, we kind of wanted to discuss, high risk
Yeah.
reasons for having planned
Mhm.
C-sections, that aren't a problem with the baby's position. And it could be, let's say, a history of like a broken pelvis or
Yes.
something. They just
Yeah.
got in a car accident and they have
Mhm.
been in so much pain, their hip is broken or something. And there's not like one clear, like in the book
Right.
reason, indication,
Mhm.
but they just went through this traumatic event.
Yeah.
They're so afraid of feeling that pain. Let's say, I'm
Yeah.
just trying to think of a random example, but there's a
Sure.
million different ways this could go,
Yeah.
of feeling this like bigger baby with bringing back the trauma of, let's say, their injury from their car
Yeah.
accident and whatever, whatever. And I'm like, great. It's not great,
Right.
but I'm like, I get it.
Right.
You say no more.
Right.
I
Right.
just,
You don't have to defend it.
and yeah,
And I'm already I'm sitting here as I'm saying, don't
yeah,
I'm defending it for
you're
myself.
defending it. But I just want to know, the only reason I ask is I want to make sure that they've gotten the appropriate information.
Yeah.
And also because I tend to know already that there is probably some other story that I'm missing. And I'd like to know a little bit. Obviously, you don't have
Yeah.
to tell me your whole like, life
Right.
story,
Right.
but if there's something about that I can, for example, be extra,
Yes.
handle you with extra care.
Yes.
They're just going to put a
We're
sticker
gonna
on
have to
these
make up
people.
a sticker word like
Handle with care. Yeah.
that.
I slap a sticker on them
Yeah.
and then I just like give them a little extra loving.
Yeah.
Or, it helps you get to know someone, it helps you connect, it helps them feel more comfortable. And I always try to just like look them in the eye and say, oh, I understand. Like, I totally get why you're
Yes.
making this decision.
Yes.
Perfect. We're going to make this,
Yeah.
good for you.
And those two words, I understand, are so powerful to somebody who doesn't feel understood.
Right.
Because to feel validated by somebody else, especially in that setting, a doctor, you're like, oh,
Yeah.
okay. It doesn't feel like you're on an island. It's like, I get this and you're going to be okay.
Yeah. I just know after hearing so many people's stories,
Mhm.
how many different things there can be that can push you towards choosing one thing or another.
Yeah.
And going back to the idea of being medically high risk, that in and of itself must bring, adding that extra layer of
Mhm.
anxiety coming into it. And obviously, not all high risk pregnancies end up with needing a C section,
Right.
but many do,
Yeah.
right? And then we were talking earlier about, really high risk. I mean, rare things like mothers who have heart problems or like severe
Right.
lung problems,
Right.
you know,
An
uh,
organ transplant. I mean, think of like
cancer.
the cancer.
Yeah,
There are things.
there are things that you have to make that decision about how you're going to deliver the baby. And there's sort of always an argument
Mhm.
from both sides.
Mhm.
And especially, I think, when there can be an argument for both sides, that's when the patient, any patient factors have to you know,
Right.
outweigh
Right.
anything else
Right.
and sort of you be the deciding factor.
Right.
You are very anxious about this way, or you are very anxious about that way.
Mhm.
I've seen people be very afraid of taking pain medications because of a
Mhm.
history of some kind of addiction or problem in the past,
Yeah.
or maybe knowing someone with addiction, and they feel like they will not have to go down that route if they have a vaginal delivery. So they really, really want it for that reason. Like
Yeah.
there's just so many different things. And then conversely, just being so concerned about the welfare of the baby and not being able to even imagine those little changes that can happen during labor that would just be too much
Yeah.
for the mom to bear.
Um,
It reminds me of, so I oftentimes will go into the room when the babies are having these kind of heart rate decelerations
mhm.
during labor. And it happens, I mean, it just happens a lot. And,
Yeah.
there's different types, obviously, right? There's
Right.
ones that last for a long time. There's ones that are just for a second.
Right.
And then
So
depending on
a
where
quick
they are,
position
yeah,
change changes everything, you
related
know?
to the contraction.
Yes.
And
Mm.
my best friend from college was having her baby and she came in for an induction, 39 weeks, and got her epidural. She is cruising, everything
Yeah.
is going smoothly. And at some point,
Mhm.
one time, like in her whole, I don't know, 12-hour labor situation,
Mhm.
the baby had a decel. And so all these people rushed into the room and they just like flipped her over and then she was fine.
Right.
And what is memorable about this to me is when she told me the story, she was like, it was crazy. All these people coming
Right.
in. I was so scared. And I almost forgot. And I'd already had a baby, but I hadn't done labor.
Right.
But to me, I just like, we do that all the time. So
Right.
it was like hearing
See
from a friend, not just a patient, but a friend,
yes.
tell you how scary that was.
Yeah. Yeah.
And for me, I'm just like, oh,
Yeah.
no
This
big
happens all the
deal.
time.
Yeah.
Yeah.
Why are you worried? It's
Yeah.
fine. Like, but when you hear it from somebody who you're very close to, you're like, "Oh, that must be scary for people,"
100%.
you know?
Yes. And also too, as the medical side, like you can have this rush and come in and check and everything's fine. Then you're like, okay. And all of a sudden you've calmed down, but like
Yeah.
that patient hasn't.
They're like, "What
They're
just
like, I'm
happened?"
still at this high of feeling like, is everything really okay? And I
Yeah,
think that's when you start getting like, is it
and how out of control.
right? How out of control? And that's what I would notice patients like, really, is everything okay? Is
Yeah,
everything okay? And
yeah,
again, they may ask you 15, 20 times and you're trying to reassure them. But again, they're still not down from that whole experience.
yeah. Your knees knocking up against
Oh,
that.
sorry. I never realized.
Yeah, yeah, so it's just I like to say this, I hope it's not offensive, tell me if it
Okay.
is.
Oh, I will, Jen.
There is no easy way to have a baby.
No, it's a way to have a baby.
There isn't.
In all caps.
Yeah, so choose your poison. I mean, C-section, vaginal birth with epidural, natural vaginal birth. There is something that someone had to go through in all of those scenarios. and it's why women are so amazing.
Yes.
And we also have the privilege, it's difficult, but it's also our privilege, in a
Yes.
way.
Yeah.
I
Oh, I very
wouldn't
much feel
want to
that
give it
way.
away,
Yeah.
but at the same time, acknowledge
Yeah.
that this is not easy.
Right.
No matter. It's not easy. You're just trading one thing for another, basically,
Right.
depending on which way your delivery ends up
Right.
happening.
But the recovery emotionally, every woman's going to have something to help her cope because it's this massive change
Yeah.
and it's physically exhausting, it's emotionally exhausting, and that's why having a way to cope after this whole experience, whether it's talking about your birth story or finding a mom friend. I mean, mom friends are your best friends
Yeah.
because you connect in a way that is so deeply rooted in the fiber of who we are.
Mhm.
It's our story for our whole life. I will definitely tell my grandchildren the story of like how why are they here? And when you really think about it, you talk about it, that is so cool that we get to be these humans on the earth that continue this
Yeah.
process of
We
life.
are the reason humanity is still
High
here.
five, Jen.
Don't forget it, everybody. No one would be alive without us.
No. Very true.
But yeah, it's tough.
Yeah.
It's tough and it's worth talking about.
And if you
And
are a high risk patient and you're listening to this, like knowing that it's okay to say, like, I'm scared throughout the whole pregnancy and
yeah.
kind of sitting with that and being okay with that.
And it often does require more appointments, whether it's more
Yes.
monitoring or, for example, appointments with specialists.
Mhm.
Um, I guess you said this might be interesting, so let's see.
Okay.
I'm just talking about the behind the scenes planning, what happens
Oh, yeah. No,
with
this is good. Talk about this, Jen.
with a high risk patient. So, whatever the case may be, if someone has some complicated medical or surgical history, we often do something called a multidisciplinary meeting, which is
Mhm.
where we come together, OB, anesthesia, nursing, and whatever relevant specialist. So, it could be a neurosurgeon
Mhm.
or a cardiologist,
Mhm.
someone who has some knowledge in whatever particular other problem that they
Mhm.
have outside of pregnancy
Mhm.
and make a plan for the patient. And we will often have disagreements amongst us onto what the recommendation should be for
Mhm.
the patient. Does the patient need this extra monitoring? Does this patient need to be in the hospital maybe before delivery for certain types of workup? Does this patient need this extra test, this extra imaging study? And one of the big ones is how should this patient deliver?
Right.
And first, not taking into account the patient's preference, just medically, what would be safest for the patient. And almost always, if you read it in a textbook, it'll say this in and of itself is not an indication for a C section. But you have to think about the anesthesia too side of it, which is it safer for them to have kind of a controlled setting where we have all of the monitors and all the extra things that we have in an operating room that we don't have in a labor room, and maybe be able to anesthetize the patient, whatever that may be, whether it's with a spinal or an epidural or putting the patient to sleep in kind of a controlled manner versus if the mode of delivery that is chosen is vaginal delivery. Well, that's great if you know you're gonna have a vaginal delivery, but nobody ever really knows for sure. And so then you have to think about, okay, what is our plan for this patient if the vaginal delivery is attempted and then the patient needs an emergency, and how risky is that emergency C-section?
Right.
Oftentimes, if there's any debate, we think about that risk of having an emergency, and then we have to think about how likely is that to happen.
Right.
So, has the patient had 4 vaginal deliveries and this
Right.
is their 5th and the baby's not big and blah, 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 blah? Or is this a first-time mom who's 45 and who, I don't know, something that makes it less likely to be successful, and then weigh that against the risk of not being able to do that slow induction of anesthesia that we would like to do without having the monitor set up and ready. But I'll tell you, most of the time, if the patient prefers the vaginal delivery, that usually wins out,
Mhm.
as it probably should, because otherwise we are focusing too much on unlikely events, which is
Right.
what we as anesthesiologists tend to do. Usually
Of
it's
course.
anesthesia,
Okay.
not me anesthesia, but it's usually anesthesia thinking through all these worst case scenarios and saying, well, this worst case scenario is so bad
Right.
that I don't even want to take any chance of getting to that worst case scenario. And I'll take the not as good middle road, which is having a C-section, maybe vaginal would be like the absolute safest or something like that. But there's just a lot of planning and things that go along. And then the plan is usually presented to the patient. And then from there, you have to say, okay, what are your goals? What are your wishes? What are you scared of?
Yeah.
And what are you more comfortable with? And then you kind of go from there and make the decision.
I think that's super helpful to give that background. It's like when you go to a play, like there's all these rehearsals, there's all the behind the scenes, and you're just like witnessing the perfect show. And
Yeah.
it's so nice as a patient to know all these conversations are being done about you to ensure that safety and your preferences and all of it's coming together to create this
And it's kind of,
as perfect
yeah.
environment as
And
possible
the
for this
ideal
birth.
way to do it is, even though not every person there may agree, they kind of come around to it. It's more like, let me be the devil's advocate
Right.
and see what I'm concerned about. And
Mhm.
then, the OB says, well, this is what I'm concerned about.
Mhm.
Let's try to weigh them together and come up with a plan. And then that's really like the way it should
Right.
should be done. And then you can also have your own discussions with any kind of extra specialists or anyone else that you may be
Mhm.
seeing and kinda get their side of things too.
Okay. I mean, the power of a conversation is so
Yeah,
important.
yeah.
We love
But
conversations.
it's just a lot of times we're just talking about the stresses of going in and having a baby or having a C-section without this history of having some other medical problem that you're dealing with,
Mhm.
and it just makes it that much more important that we focus on giving you the best experience possible despite, I guess, everything else that's going on,
Mhm.
and how much even more you deserve that, I
Yeah.
think.
All right. Are we ready to wrap it up?
Yeah.
Okay. So I was in the city, grab my purse yesterday, and I went into my favorite botanical shop. And something that was,
What's a botanical shop?
oh, botanical. Okay, we're going for a
Flowers?
field trip. No, it's like
Oil,
oils and
okay.
cheese and all crystals, everything I just
Got
love
it.
so much.
Bethany shop.
It's a Bethany shop.
Okay.
It's on Crosby Street, and it is my favorite shop,
Okay.
and we will go together. But a big thing that I helped myself, especially with my second and third pregnancy, when I thought more about how to cope with things, was like the power of scent
Mhm.
and how it really holds our memory when we smell something. It like jars a
Yes.
memory that like for me, when I smell a strawberry fruit roll up, I think of my childhood.
Mhm.
What do you think of when
Me
you
too, I think.
yeah.
Yeah, I can smell it.
Right?
Mhm, I can taste it too.
So I think that again, we were talking about how we can help ourselves cope ahead of time and just give ourselves those tools. So this is a tension blend that I'm gonna have you put on, Jen, and sniff.
Sure.
Uh-huh, you can put it anywhere, you can put it and so it's really nice, like, you
Pungent.
don't think that things like this are gonna make such a big difference, but when you are feeling high anxiety, I really recommend trying to find something that will help your sense of smell feel calm as well.
Yeah.
And then when I was in the shop, I found a card that I then, of course, had to read out loud. So this says, one day it will be so clear. What you thought was the end was really just the beginning. Some doors are hidden until we are ready to open them. I think that's a good
I
one.
love it.
Yeah.
Where was this card?
At the shop.
Just sitting there
Yeah.
for free?
Yes.
Take one?
Yes. They just have these all over the store. It's
It's
also
meant to
why I love
be.
it. You just go
Yeah.
in there and you just feel
Just get
better.
a little inspo,
Yes.
feel good, feel calm.
I did. I did. It's just going to get me through
Well,
this
this
whole
smells
month.
really good.
Yeah.
How would you I think it's kind of minty.
It's kinda minty. I'm sure I can look at All right. So this is very small, but there is peppermint. Yeah, definitely some peppermint in there.
Like minty
Flower
and
oil,
floral.
leaf
Yeah.
oil. All right.
Like
Make it feel like I need glasses trying to read this. I'll post it
okay.
because I think this is a good one. Again, put this one in your toolbox along
Yeah.
with your 478 breathing technique.
Yeah. We
Combine
are
it together.
preparing you.
Yes,
Take care of
yes,
yourselves.
yes, totally.
And follow us on Instagram.
Yes. Send us an
Send
email.
us an email, please, please, please.
Hi at csxpodcast.com. We want to know your stories or if you're preparing for birth, if you have a specific question, we'd love to
We
answer
want
it
to
for
chat,
you.
so
Yes.
let's talk.
Yeah. All
Right.
right. Bye.
Bye.